Few things affect people more than the topic of money. Yet, we don't talk much about it. We trudge along and hope things work out, but never really know for sure. I think it's time for some answers. Hi, I'm Tom Stone, and welcome to Talkin' About Dollars and Sensibility. Today's show is brought to you by Guild Mortgage Company, closing loans and opening doors since 1960. We're located at 175 North Main Street, right here in Heber City. Our phone number is easy. It's 435-654-9979. That's 654-9979. Or just come by and see us. We're located right next to the car wash on Main Street on the 200 North Block. Today, I've invited Jay Eckersley with us today. Welcome, Jay.
Thank you, Tom.
Let me give you a little introduction to Jay. We're going to talk about health insurance today, but let me tell you why I invited Jay to this. There's some things that we need to know. This is a gentleman that I've got to know in the last couple of years, but it's fun to realize the history and what he has behind him. Jay is a leading national health. I'll try that again. I'm on live radio. I got to start over. He is a leading national healthcare consultant, and he specializes in leadership training and culture development with Franklin Covey. I said that wrong again. Franklin Covey. I hope this show goes a little better than the way I've started this. He managed care initiatives and revenue enhancements at Gosser Group. He's been in St. Louis, Missouri, health insurance field underwriter with Nash Agency. He is an award winner at Health Systems with St. John's Health System. That was in Springfield, Missouri. Grant Riverside Hospital, Health Systems, BJC Health Systems, Alina. Did I say that right? Alina. In Minneapolis. I think it's because I'm used to just talking about Heber names. That's my trouble here. Minneapolis, St. Paul, Minnesota, and of course Intermountain Healthcare here in Salt Lake City. Stephen R. Covey quotes by saying, Eckersley brings health industry credibility, a current cutting-edge consulting perspective coupled with background CEO experience. Now, for those of you who are simple folk like me, what that means is Jay knows what he's talking about. Jay, I kind of slaughtered that a little bit. Can you just tell us how you came to Wasatch County and just give us a little more a background of the last few years and what you've been doing?
Sure. Thanks, Tom. What you really did was add up 65 years there. Most of my work, I graduated from the University of Utah 100 years ago and ended up working with the Intermountain hospitals before they were Intermountain. And since that time, I've worked with what would be called, in my industry, highly integrated healthcare delivery systems.
Okay.
IHC is a good example of that. What that means is systems that have effectively put together the physician component, quality, a hospital component, and then the part we're talking about today, which they call managed care or health insurance. How do you take physician hospital services and get that in an insured form to folks?
Okay.
And these systems do a wonderful job of that, and I've had a fine career working in the Midwest and here. How I got back here is I retired to go on a mission for the LDS Church in New York. Came home, our children had moved west with, and believe it or not, with the 9 grandchildren, and so we pathetically or happily followed them west.
Are they happy about that?
I think they are. I put in a swimming pool so they come to see me and Grandma.
And the pool.
And we're happy to live in Midway now, and delighted to be in the Valley, delighted to be in Wasatch County, and delighted to meet friends like you.
Well, not only does he know what he's doing, again, he's a friend of mine. I've known him since he got here, and my whole family knows him and thinks he's a very cool guy. So we appreciate you being here. Health insurance. I mean, where do we start? We talk about Obamacare. We talk about all these health insurance things. Where would you start trying to help somebody understand health care and health insurance? All we know is it goes up.
Well, and I'm sorry to say that's the case under healthcare reform as well. This is a most significant time. So, in a sense, those who don't know a lot about it
which is most,
are on par with those of us who do know a lot about it because things are changing so much. If I can give you a brief overview, excuse me, of Obamacare, I think I can help you and the listeners
Mm-hmm.
contextually know where we are and why it's so significant.
Okay.
And I'll do that real briefly, Tom. The backdrop is there were actually two laws passed, not acts, not regs, laws. It's the law of the land,
Okay.
passed in March of 2010. So it's been with us for a time. The two laws, one is called, most people have heard about it, the Patient Protection and Affordable Care Act, sometimes called Affordable Care, sometimes called ACA, but that's the law, Patient Protection, and then the not intended joke, Affordable Care Act,
Mm-hmm.
because costs are going up.
Right.
The second was a law called the Health Care and Education Reconciliation Act, and that was actually a cleanup bill or an act, and the two of them passed together. So we have Obamacare since March of 2010. Together, these two laws have changed the rules that guide and control America's health programs. Some people think that's just government health insurance. The fact is, what's been called Obamacare changes both government plans, private individual health plans, so it affects you and me, employer-sponsored group health plans, so it affects all the employers. So it sweepingly across the country has reformed the way healthcare
Does that really
paid.
include everybody then? Every health, or is there anything well that's not?
It essentially includes everyone with the few exceptions of Medicare, which is a huge program, Medicaid, the CHIP program. Those were essentially left alone. But all the rest of us are covered under one form or another under Obamacare rules. And here's my next point. I only have a couple of additional points. I think what is core and not talked about enough to the healthcare reform that has taken place is, and in my whole career there was a debate, should healthcare be a right of citizenship, or should it be a privilege for those who can afford it? And for those who can't, let's provide some very effective safeguards or safety nets. Medicaid is an example.
Okay.
Medicare is an example for the disabled and the aged. CHIP for the children. So my entire career, I'm now 65, the answer has been it's a privilege that you pay for, and if you don't have the money, we'll catch you in one of these safety nets. In March of 2010, what actually happened is the debate shifted under the current administration, and the law passed, which is it is now a right of citizenship. Under the former plan, it's estimated 20 to 30. Some have focused on the number 23 million. 23 million folks fell through the cracks. Some people call our healthcare system the best in the world. I'm on that. I've been quoted as saying that. And some would say the healthcare system was broken. You've heard that too. And I've said that. That's a pretty big crack to have that many people uninsured. So, excuse me, what took place with Obamacare in March 2010, for right, wrong, or indifferent, it is now a right of citizenship. So if you have documents, and if you're a U.S. citizen, if you're an immigrant with documents and a U.S. citizen, you now have a right to health care. That's about as big a deal as you can get. My last point is, although parts of the health care reform plan were challenged as being, quote, unconstitutional, this process, if you recall a few years ago, went all the way to the Supreme Court, specifically regarding the individual mandate, or the law requires that you and I purchase health insurance or be covered, as opposed to uncovered and use the ER for my primary care. Well, the law was upheld at the Supreme Court. So I think, in short, healthcare reform, as it's been described under Obamacare, is here to stay.
And how do you feel about that?
My view is when I go out and do consulting, which is what old executives do, almost all of the consulting projects I'm involved with, people are worried about Obamacare. What's next? What's going to happen to me? My summary is, first, stop calling it the act, call it the law, because it is. Two, if you want to repeal it, go through the process and do so. It's pretty unlikely.
Okay.
that the courts aren't going to turn it over, it appears. The Congress isn't going to turn it over.
So
At
being a
least
law
they've tried.
truly means it's that much more solidified, and that's why your stance is
Correct.
it's here to stay.
And you've got an administration who isn't going to overturn it. So what I say to my clients is, okay, it's the law. Let's go learn how to make it work for us. And I close with what used to be smart still is. Learn how to manage that line item called health benefits because your employees need that and you as individuals need it. And so I'm generally optimistic and trying to make things work on a go-forward basis. Lastly, the reason I'm optimistic is I'm old enough to have seen a lot of plans go in. I'm even a student of some of the Social Security history. And Social Security went through 6, 7, 8 major iterations over time to make it affordable. My expectation is that the Affordable Care Law will go through, as it is as we speak, since 2010, it will go through iterative refinements and over time achieve its goals of covering the population as a right of citizenship and at some point getting it so that it's affordable. We're dealing with trillions here. This is the kind of entitlement that can break the bank. And so we all have a lot of skin in the game to say, let's figure out through our elected leaders and those who are appointed, let's make this Obamacare system work for us. The refinements that we'll experience may be very significant. To some people it may say, gee, we overturned paragraph A and Z. To others they would say, well, these were anticipated refinements. In the middle is somewhere probably the truth, but it's the law. We'll live with it, and we'll figure out how to improve it over time.
What's the viewpoint of, I'm going to call it, let's say, the physicians, so the doctor's office? Are they excited about this? Now, again, I'm asking your opinion and what you've seen, so maybe that's a case by case, but are they being, is it changed? In other words, the way they get paid, the way they do services, is it different at the physician's office with this certain Obamacare situation?
That's an interesting one. I've worked with physicians through the years as not as partners, but in a partner-like way. And so I don't usually speak for my partner, but
Got it.
at your request, I'll tell you what I hear, and
go.
that is there is a mix from completely across the board, those who think it's socialized medicine that they never wanted to get into and that they one day will be a, quote, employee of the government. But that's not the case. Or those who think nothing's changed and I don't have to accept government-sponsored health insurance. I can work off of cash paying patients. That's also not true. The fact is, the way physicians and, for that matter, hospitals get paid for many years has been working with government and all the private payers as well. Some people aren't aware that Medicare and Medicaid account for, and have for decades, way more than 50% of the business of any physician, of almost all physicians and hospitals. So from a reimbursement standpoint, I don't see the change as affecting the providers any more than usual. Every 4 years, the providers get hit because people think they cost too much. They use high technology, and everybody wants the best care they can get. And they have developed an amazing healthcare system, the best in the world. But they're fine. The doctors are fine. You'll hear it on left and the right. The hospitals are fine. They work on very small margins, believe it or not, 1%, 2%, and 3% margins. And the nonprofits plow any retained earnings right back into the organization. So the providers are fine. It's you and I as the consumers of health insurance who some of us have seen on average 20 to 30% increase in our premiums. That's not the way it was sold. It was supposed to go down, and it hasn't. Those who qualify for the 2 subsidies that the Affordable Care Act brought forward.
What are those? Make sure we know what those are.
And the one is for premiums. It's called a premium tax credit.
Okay.
So if my premium is X and my income is low, certain thresholds, and that ranges from about 16 to 20,000 for an individual, and up to 40 and 50, sometimes $60,000 for a family of 4 or 5 or 6. If you're under that number, you may qualify for a premium tax credit, an advanced premium tax credit. So it reduces the premium I pay for my insurance, which, by the way, just went up about 20%.
You're right.
The
So it goes up and then goes back down.
yeah, it went up and it goes down, but it goes down significantly more for those who need it.
Okay.
The other credit is for those where the deductibles are a little more than someone can handle, and again, based on primarily income, you can get some help on your deductible. So we're the ones who are experiencing the big change, not per se the providers as much, but we. Premiums are up, deductibles are up, and, however, we're in the process of enrolling people who have never had health insurance.
Right.
And they're getting help when they need it. So those are some of the purposes.
Are they being sought out, these people, or do they just elect to go and get it? Since it's supposed to be basically a mandate, a law, a right, are they being sought after, or is this something that, hey, here it is, you can come get it if you want it?
That's a great question. They are being sought after,
Okay.
And it is the law. The government, you might notice, watching television programs or listening to radio, has purchased very large blocks of advertising or education time. And so, furthermore, Obamacare put in place helpers like your insurance agent, or more specifically, navigators who were trained and paid to help people who didn't have insurance get insurance. So
navigate the website, navigate the paperwork.
Exactly.
Okay.
And as you know, the website started out pretty rough.
Yes.
The open enrollment went from October of 2013 to March 31. And for those who are counting, that's next Monday. So the good news is we're talking about it here today. The tough news is the deadline is right around this weekend.
Yeah.
And that's putting pressure on the technical on the computers as well. But there are navigators, and somewhere in this program, I'll be happy to share with you a couple of phone numbers people can call if they need a navigator, a helper, an application assister to help them get through healthcare.gov, the sign-up process for establishing an account, and the purchase of a health insurance plan. And it's on that website where you're able to determine if I'm qualified for any financial help subsidies.
You're listening to KTMP 1340 AM, your hometown radio station. Today's show is brought to you by Guild Mortgage Company, closing loans and opening doors since 1960. Today we have Jay Eckersley talking to us about healthcare, giving us all sorts of information that I know I don't know, and most of us don't, and we appreciate it. Tell us about COBRA insurance.
Okay.
Is that something that's still going to be ongoing, or is it replaced? What is it?
COBRA is not replaced, and it is ongoing.
Okay. And for those who don't know what it is, what is it?
COBRA is an insurance program that was set up back in, it's called the Consolidated Omnibus Budget Reconciliation Act. So
Good job. Actually, I couldn't have done that. You heard me trying to pronounce the words at the beginning. I couldn't have done that.
You see why the acronym has been employed.
Yeah.
It was set up back in 1986 to help terminated workers or workers who, due to reduced hours, keep their health benefits. This was prior to Obamacare. Persons who have lost their health insurance, by this law, have the right within 60 days to sign up for what's intended to be about an 18-month temporary time period for the same insurance they had before they lost it.
Okay.
That's the good news. The tough news is you pay the full premium. Remember, employers, if you have a group plan, usually the employer is paying 50, 60, 70, 80% of the premium. You pay the balance. When you go on COBRA, you pay 100% of the premium. So the good news is I get coverage. I don't go bare. That is very good news. The bad news is it's very expensive. So what's happening with those who are on COBRA, they are not affected by the Affordable Care Act, with the exception that most of them sign up for it, and now they're shopping, just like you and I are, for more affordable care. And in this case, it's always a reduction. When they go on the government website and they look for plans similar to their own, they're going to find a reduction in premiums. So that's a good leap from unemployment or reduced benefits to COBRA bridge coverage, and then into the Affordable Care laws, the metaled plans.
So if I'm on Cobra, I can go on to the website and I can find more affordable insurance?
Yes.
So then why would I be on Cobra?
Well, just because of the trauma of having your hours reduced, your health insurance taken away. So your health insurance has been lost. And so by law, COBRA back in 1986 allows you to bridge.
Okay, so it's just that time frame in between.
It's just that time frame. And I think it's still wise. From 86 is when it was installed. But even today, if you become unemployed and your employer was providing a group plan, you have the right to pick that same group plan up, pay 100% of the premium, and then go shopping.
Is Cobra always more expensive?
I'd say probably yes. And again, it's because of whatever employer you had, they were likely paying a portion of the premium. And it's usually 50% at a minimum, and most often 80-ish percent. So to now pay that full amount is sticker shock.
You bet.
And under the Affordable Care Act, the plans that have been put together are equal to or better than what you used to have, and the prices are not as high as COBRA.
Being self-employed, does that change this up? Let's go with sole proprietor. 1 to 10 employees, that kind of a number. What kind of insurance is it? Am I stuck with COBRA, and then I go to Affordable Act? Is it different? Does it change anything?
If you're self-insured, the individual mandate applies to you. So that's the shortest and most accurate answer is you're under a mandate, a law, to get coverage. A lot of self-insured persons in the past did not. You can still get catastrophic coverage if you like, or you can get different levels of coverage, but you're on the hook like all the rest of us to go get
You got to pony up.
insurance. You got to pony up. These are the folks who are feeling some of the shock of increased premium rates.
Again, because they're paying the whole premium, like you said.
So
is it more expensive for a self-employed person?
No.
It's just that they have to pay the whole premium. That's why it's more
Correct.
expensive.
That's correct.
Okay. So no different being self-employed other than you're on the hook for the whole thing.
Correct.
Now, this is a question I know that's unfair, and you won't give me an answer, but I still am going to ask it because I want to hear a little bit of what you say. How much does health insurance cost? In other words, if I am a single person, I am married, I am a family, what kind of numbers, if I'm spending a certain number, and I know you can't quote me numbers, but give me some idea, are we talking about a percentage of my income? How do I know when it should be in this ballpark?
Well, you've really asked two good questions there. One is percentage of your income. The folks who built the law felt that if you're paying more than 9.5% of your gross income a year, then you're in trouble. It's an affordability issue, and so they've tried to 9.5%. Okay. So they've tried to design the plan that for people who have low income, and therefore this premium would take nearly a 10% cut out of their income. That's where the name affordable came from.
Okay.
It's their view that people should be able to have health insurance, quote, affordable at 9.5% or less of their gross income. As far as what does it cost, you're right. It's across the board, and I'll give you some numbers just because you're twisting my arm.
Awesome.
I've seen premium rates at less than $200 a month, and I've seen them at $2,000 or more.
Mm-hmm.
So that's a pretty broad range.
That's broad.
And that's why quoting numbers isn't all that helpful to
Right.
you. But underneath that is what's it based upon?
Mm-hmm.
Your premium is based on your income, no surprise. Also your age.
And the age is, does it go less the older you get?
Uh,
How does that work?
it's actually pretty high for the young,
Okay.
and it's not a linear curve, and it's not a really a fully uniform curve either. But a summary for you is older people get a little more of a break
Okay.
than the younger person.
Know the benefits here. You get the early bird dinner. You get into movies cheaper, and you also can save a few bucks on your health insurance, comparatively speaking.
That's correct.
So there are benefits.
There are benefits
to
to
getting
older and walking differently than we used to.
Okay. All right.
Income, age, interesting geography is folds into the algorithm.
So if I move, I could save $1.
Yeah, but you're not going to want to figure out where the lower cost places to move.
Okay.
It isn't as clear as can be, but you can anticipate both coasts are a little more expensive to insure for health care because the costs.
Do you know why
are up.
that is?
The costs on the coast for health care have typically been higher. The real estate values on which you build your physician office or your hospital.
Mm-hmm.
Technology is high for everyone, not based on geography. And then the employment rates are a little higher. Salaries are a little higher. And that's probably the thing that you watch closest because more than half of the provider costs are tied up in their people. Their people are highly skilled, highly trained. And on the coast, the cost of living is a little higher. And
So 9.5%
Mm-hmm.
is just higher because they make more.
They do.
Got it.
The other things that add into your premium is gender, men and women. And then the only...
Not to create a competition, but is it cheaper to be a man or a woman?
For health insurance, it's a little cheaper to be a woman. For life insurance, which is a different story, it's a little more expensive to be a woman.
Okay. Interesting.
And the only, quote, pre-existing condition, if you will, and I should probably go back and define that for you.
Yeah, that's one we should bring up.
But the only pre-existing condition that made it through the Obamacare gauntlet was smokers. So if you smoke, you pay more, period. The data backs that up. But
So Obama pays more.
that's correct.
Okay, got it.
If I may, let me give you a quick update to the progress on Obamacare and how it's going,
Yeah.
because we're coming right up to a deadline that has a lot of people concerned. Some think the deadline will be extended yet again. It hasn't yet, and we're getting pretty long into the week, so it may not be. The progress to date, remember Obamacare was set up to be installed from 2010 to 2018. That's a long install. So how are they doing? And this will have a little bit of my opinion in it.
Okay.
But I think I can back it up. They wanted to increase access to coverage. 20 to 30 million folks. Say 23 million folks.
The fellows and the people who fell through the cracks we're talking
Correct.
about. Okay.
So how's that going? Well, I'd give it a yes. It is increasing those who can get health insurance and affordable health insurance based on the 9.5% I shared with you. Second, these aren't really in a priority order. It was intended to improve the quality of coverage in your health insurance plan. And interestingly, that answer too is yes. Now this is a smidgen controversial, but when Obamacare was designed, there were installed 10, count them 10, essential health benefits. The notion was, accurately, that some health plans were pretty bare bones. And some of that is because I wanted to buy a bare bones plan. But some of it was insurance companies were throwing bare bone insurance plans out there, and then it was a surprise to the enrollee when they became ill and they found their insurance wasn't very rich, it wasn't very helpful.
Yep.
So Obamacare, in its wisdom, said, well, what would be the minimum termed as a quality health plan? And they came up with 10 essential health benefits. So I'd call that an increase in quality, because all plans sold today, not just government, but private and employer group plans, have to include these 10 essential health benefits. I can articulate what those are, but that's a little long. What I would say by exception is what all plans used to didn't have was mental health coverage. Well, now they must. What all plans didn't used to have was obstetrics care, believe it or not. To have a baby, you had a second deductible.
Yeah.
You had your major medical deductible, and then to have a baby, you had another deductible, which was pretty stiff, $6,500, something like that. That's no longer the case. So OB is an essential health benefit, or maternal and child health. And then the other one is pediatric dental. And I don't know as much about that, but it's a way of getting children preventive care. You know, every 6 months you're supposed to go in. So how Obamacare is going in, greater access, I'll give them a yes. Again, this is over 8-year install. Improved quality of coverage, I'll give that a yes. More affordable, sadly no. It was sold that way. It is on average about a 23% increase for all of us who are not getting a subsidy. For those who are getting a subsidy on their premium or their deductible, it is wonderful. They can now afford it. They now get coverage they've never had or haven't had for decades. And so you got to give that objective a no. It's not really affordable. It's $1.2 trillion. The CBO is usually off on their estimates. And that's a large, large number. So, as I said earlier on, it's incumbent upon all leaders to figure out iteratively how will this thing become more affordable, or will it break us? And then lastly, in their progress, they were intending to improve the accountability of health insurers. And there were quite a few shots.
Health insurers. Insurers, thank you.
Companies. There were quite a few shots, as you recall, at health insurance. Who loves a health insurance company?
Right.
And there were a lot of shots taken at them. And of course, just like the rest of us, they're good companies, they're good people. But they had their foibles as well. And I would give that a yes, that through this increased regulation, this increased standardization, the essential health benefits and so forth, I think the health insurance companies are more accountable than they ever were. They've been encouraged.
To whom?
To the consumer.
To the consumer, okay.
Providers, sure, doctors and hospitals, but to the consumer. And we rely upon them to put good products together, make sure they're of a high quality, and to not break the bank as far as going bankrupt because you have too high a health coverage, especially if you're well, I'll just leave it at that. The health insurance company's accountability, I think, there's a term used in Obamacare that I think is a good one, and it's called to be an accountable care organization, or a good citizen, so to speak, or really good in the community. Companies like Intermountain Healthcare are encouraged to be accountable. Companies like Blue Cross, Blue Shield, or Select Health, or Arches, or the others, Altius, and so forth, they're called upon to be more accountable, and under these regs they are. Now, lastly, who's called upon to be more accountable is the individual. You are accountable to get your own health coverage, and you'll have an incentive to increase the wellness or the health promotion aspects of your life.
You're listening to KTMP 1340 AM, your hometown radio station. Today's show is brought to you by Guild Mortgage Company. Your loan on time, every time. Today's show, I have Jay Eckersley talking about health insurance. And Jay, we left just a second ago. That leads me to this question. How do I shop for health insurance? You mentioned some names of different companies out there. How do I shop, specifically if I'm a self-employed, self-insurer type, those particular, and is it so regulated that they're all going to be the same, or is there truly a difference in what these different companies would charge me?
Again, good question. The quick answer is you go to healthcare.gov.
Okay. So are they all connected through that then now?
And they are all connected through
They're all
that.
there. Okay.
So that's the quick answer. The background to that, if you'll indulge me a little, is important. The reason you are there shopping is because you have a proactive interest in upgrading your health insurance or achieving health insurance for the first time.
Mm-hmm.
And what's driving you is the individual mandate. So under the Affordable Care Act, Obamacare, or the law, you are now mandated. As I mentioned earlier, it was upheld in the Supreme Court. It's legal.
Mm-hmm.
And you're mandated, or it's the law, just like you're mandated to file your income taxes.
Mm-hmm.
You're mandated to get health insurance. Let me talk about that individual mandate and come back to finishing up how do you go get it, especially if you need some extra help on this last week. The open enrollment period for the individual mandate was October of last year through March 31, or next Monday of this year. What's remarkable about Obamacare is, at least in my lifetime, is there is no medical underwriting. That's a fancy term for saying, in the past, if you had a chronic disease, meaning doesn't get better,
Pre-existing conditions.
or pre-existing conditions, or you've had bad experience.
Mm-hmm.
There are a lot of horror stories of people who got sick 3 times in 1 year, and then their insurance company terminated them.
Mm-hmm.
And then you go out to buy new health insurance, and they say, oh, gee, you were sick 3 times last year. We'll call that pre-existing, and we either won't cover you because your risk is too high, or your premium is going to go up 300 or 400%. Mm-hmm. That's part of the prior system that was, quote, really broken.
Yeah.
So some could say the people who needed coverage the most couldn't get it when it was, quote, a privilege to purchase. Well, now as a right of citizenship, these plans that Obamacare regs have required that all insurance companies write anew. So all the insurance companies have written new plans to comply with Obamacare rules. In those plans, there is no medical underwriting, no pre-existing condition requirement. That's wonderful news.
Huge.
For everyone, and it is huge.
Including mental illness.
Correct.
Which that's been a huge question mark, and how do you handle it, and is it real, or all those things, and is it accountable for? So that's gigantic.
And here it's determined under the essential health benefits as a disease, and it has payable as coverage, just like other medical conditions do. Health insurance coverage. OB I mentioned earlier. Sometimes people don't know if they're expecting. Once they're expecting, try to go get insurance in the old days.
Yep.
Well, now you can be an expectant mom, and you can go buy health insurance, and and you will be covered at delivery, and so will your baby. Another change that's an improvement is there's no longer an annual or a lifetime maximum benefit. In the old days, the insurance companies would put a cap. And so if you've been an ill person, or you've had an ill person in your family, and you're running up insurance bills, some of which you're paying, some of which the insurance company's paying, you could get a letter that says, oh, by the way, you're done for this year, and there was a lifetime max.
You hit it all.
You get it all. And so now you are essentially uninsured, and you have to go on the safety nets of Medicaid, or if you get old like I am, Medicare.
I have a question real quick.
Yes.
So a few years ago in my group plan, somebody had a premature baby, which cost, lots and lots of hundreds of thousands of dollars. And our group plan insurance went up. They said, because of the person in your group costing so much, everybody had to pay more. Does it still work that way? Whereas a group plan, by somebody having more expensive premature baby or a cancer or those kind of things, would it do the same thing, or is this Affordable Care Act, it just kind of goes across the whole nation and it's not as big of a deal on a group plan?
What you just said at the end is the answer.
Okay.
The reason it went up in your group before is because your insurance pool was relatively small. So when someone had a premature delivery and had a $100,000 bill, that would affect the group's rating. That's the risk of covering a small group. What's happened with Obamacare, like you just said, is we just increased the risk pool, essentially to make it national.
I see.
So that one premature birth isn't going to have the same kind of blip or effect on everybody's health coverage that the one did. So that's good news too. It's a large risk pool instead of a small risk pool.
How are they handling cancer?
Same way.
So cancer used to be a separate thing, wasn't it? Or it was handled differently? And
It used to, cancer in the past was under your medical insurance. Some people, few, would buy a separate rider for that paid higher percentages for cancer care. Today that's gone, and cancer is just one of the 10 essential health benefits that's covered in your health plan.
Okay.
In fact, I can go through those real quickly. But I left off on you've heard well in the news that one of the other changes on Obamacare is if you have a 26-year-old dependent child, whether they live with you or not, and they're in that crazy time of between school, or they're in this economy that we've been experiencing where they are unemployed or underemployed. Those persons, and there's been a lot of positive stories about kids, those are adults, who can now get coverage under their parents' plan up to age 26. After that, they're on their own just like you and I.
Okay.
But that used to be back in the 18-year age, or if they went off to college, they had to get their own insurance. Well, that's no longer the case. They can add. The 10 essential health benefits include those that you would expect: ambulatory care, emergency services, hospitalizations, in and outpatient, maternity and newborn, which was greatly enhanced, as I mentioned earlier, mental health, substance use disorder services. Those were very few. Those were very narrowly covered in the past. It's now covered like any other medical element. The pharmacy services, rehab and rehabilitative services. The last three, lab, that was used to be in there. Preventive and wellness services to help deal with those of us who have chronic disease. That's a very important element. You know the old Pareto principle, the 80-20 principle. Well, in healthcare too, there is a Pareto principle, and that is 80% of the costs of health coverage are tied up in those of us
20% of us.
Yeah, the 20% of us who have contracted a chronic disease, by definition meaning it doesn't get better, but you can manage it, like congestive heart failure or congestive pulmonary disease, or like cancer, as you mentioned earlier. These chronic disease patients can be medically managed to be more healthy, not cured, less visits to the inpatient services and the ER because they have a nurse on them. I remember where I used to work, we used to take flu vaccines out to asthma patients. That's a chronic disease, instead of waiting for them to come in and get them. And that small act of sending a nurse out to those chronic disease asthma patients kept those people from coming in on average 2 times a year into the respiratory intensive care center of a hospital. Well, that increases their health, increases their quality of life. For an employer, increases their productivity, and, by the way, it reduces cost to the system.
So a little cost up front, preventive nature we're looking at, truly works that they aren't spending more money in the long run.
Right, and that may be, you said that well too. That's one of the overreaching theses that you need to build into this program. Is there always was an incentive, there is even more so now, an incentive for us to promote our own health, become more well, eat well, exercise well, become more well, so that our healthcare costs, our quality is good, our productivity is good, and our costs are something that we can stomach, that we can handle.
Sure. I have another question.
Yes.
So let's go to cancer. Let's talk about Medicaid, and let's talk about the state of Utah.
Okay.
I have a friend of mine who's stuck in between. He's been dealing with cancer. He's got to get some more tests done. He's on Medicaid, waiting for the governor to sign some things or such. Tell me what's going on with that.
That's a very current issue, and I'm not an expert on that. This isn't as much an insurance question as it is a political and policy question. Each state runs their Medicaid program, and Medicaid is set up as a safety net for those who need assistance. Um, and under Obamacare, there was a very strongly worded request that the states consider expanding Medicaid. Some states cover up to 80, 90, 100% of the federal poverty limit, which I think is about 23 or so, don't quote me on that, 23 or so $1,000 for an individual, and a little higher for, excuse me, for a family. And some states, Obamacare was requesting that they go up to 120 or 133% of the federal poverty limit. In Utah, and you go through all 50 states, and you'll find those who have expanded Medicaid thresholds, and those who have kept them where they were. None have reduced them. The federal government has something to say about this, because even though the states run Medicaid, it's on a matched basis or a shared cost basis. The states put up a lot of their budget, and there is typically an equal amount matched by the federal budget. So they're a partner with you, if you will. And in Obamacare, they said to the states, as I said very boldly and strongly, but they couldn't mandate it. Governor, we want you to increase your Medicaid thresholds. In the state of Utah, governor came out just in the last month or two and said no for multiple times. This question's been on the table since 2010. He has a plan in mind, which I'm not expert on, which is to seek federal grants for those who have particular Medicaid needs, give them a voucher from that grant money, and tell them to go on healthcare.gov and get their own insurance like the rest of us. So call that a third subsidy or a third assist. To date, there has not been an expansion in the Utah Medicaid thresholds. Will there be? Who knows? But to date, it's I think it's 100% of the federal poverty limit.
Okay. What about supplemental insurance? Meaning, so it looks like we've got some good coverage, maybe some extra things covered. What about supplemental insurances? Or should we be thinking about getting anything extra? And obviously there's the AFLACs that talk about paying your bills, and that's supplemental insurance. But give us your opinion of what you feel, if there is a need for supplemental insurance for healthcare specifically, and even give me your opinion on the actual while you're out of commission insurance.
Okay. I'll answer that two ways, Tom. If one is and I'll do the first one real briefly. If one is a Medicare age eligible person, like I become in August, I just got my letter in the mail that said, "Hey, you're becoming 65. You can sign up."
Congratulations, by the way.
Yeah, I had mixed feelings on that, but nonetheless, if you're a Medicare enrollee, there is a big market, some would say a need, for supplemental Medicare insurance. Because there's a larger portion of self-pay in Medicare than most people think, and typically a little more than what they were used to in their individual plan. So you'll find a lot of Medicare enrollees sign up for a supplemental.
And Medicare didn't change.
Correct.
And that stayed the same. Okay.
So you'll find a lot of people signed up for Medicare supplemental, but you don't have to. There's another option. It isn't really a supplemental. It's called Medicare Advantage, which is another form of Medicare where it's an HMO function, and most of the large health plans have an Advantage plan. So just staying on the word supplemental, it usually relates nowadays to Medicare enrollees who may wish to write a supplement to their Medicare coverage. Back to the individuals, like you and me for a little while longer, there is not, how do I say that? There is not a need for supplement. There is not a market for you to go out and buy supplemental insurance. Rather, Obamacare put up requirements for health plans and then rated them. They put a name on them called bronze, silver, gold, and platinum. In lieu of a supplement, if you want enhanced benefits a little bit, you might want to shop for a gold plan.
Okay.
Which is a little richer than a silver
and those
plan.
are the private.
Correct. So when you go on healthcare.gov and you go through all and you get your account set up, it will then take you shopping, and it will say, do you want a bronze plan? Do you want a silver plan? Do you want a gold plan? and you look at the terms and conditions of those and say, I think the following is the right one for me. There's a third part to in answer to your question. What are the main variables in bronze coverage, silver coverage, or gold coverage, knowing that all of them are quality now, all of them include the 10 essential health benefits now. There's 3 variables that most people will check when they're shopping. One is premium. What's it going to cost me each month? Well, you look at your own budget and you say, okay, that's an important variable. Balancing that, almost like on a teeter-totter, is what's going to be my out-of-pocket deductible. If I take a $5,000 deductible plan, which means I self-insure, or I pay $5,000 before my 80/20 silver plan kicks in, a $5,000 deductible is going to drive down my premium cost. If I want a deductible that's only $250, then my premium cost goes up. So that's a balance, and who's best to make that judgment is you. You're essentially taking the accountable position of saying, I want to go determine what's the right insurance for me. Okay, here's the premium I'm willing to pay, here's the deductible I can handle, and then you select. The last of and there are more, but the third of 3 variables I'll share with you is an interesting one too, and decision should best be made by the individual, and that is, how big is my network, my provider network? How many doctors are in it? Is my doctor down the street in it or not? The health plans, again under Obamacare, had to standardize into their networks. There's a tiny network. It might be 3 or 4 counties. I know a person who lives in the Alpine area who was happy to have an insurance plan that included physicians and hospitals in Utah County, Weber, Davis, and Salt Lake County. That's it. That's a relatively small but highly dense network. For him and her, that was the right network for them. Well, the small network costs a smidgen less than the medium-sized network, which includes all the Wasatch back, for example.
Does that go with the gold and the bronze stuff?
No, that's a third variable.
Okay.
So when you decide, here's my premium and my deductible, the third variable, it's 3.
Got it.
I can count to 3. I can't get much higher than that. But how big is the network that I require? So there's a big, medium, and small.
Okay.
For those people who live on the Wasatch back like I do, you're not going to want the small network because it doesn't include these counties of Wasatch and Summit, etc. Nor does it include the Park City or Heber Valley Hospital, the Intermountain Hospitals over here. So for me, I start out with, I need the medium-sized network because that's where my doctors and hospitals are in my neighborhood. It always includes referral care down to Salt Lake County. And then the largest network is the one that includes the University of Utah, for example, and as the only academic medical center in the region. So 3 things. Check out how big is the network you require for physicians and hospitals for primary care and referral care. What's your budget for premium, and what might you want to pay as an out-of-pocket deductible each year?
So everybody, all the providers are forced by law to participate in this, but they still can and have maintained their different variations of price, their different variations of deductible, premium, and even available services. That hasn't changed, and you can still shop for that.
That's correct. And it's probably clearer than ever, a little simpler than ever, and it's all on the health plan websites, like Select Health has their own website. They even have a link into the federal website, so you can do all your shopping on that website if you choose, or the federal website. So it's kind of easier to say, do I need a small, medium, or large network? 2, how high a deductible do I want to self-insure? And then here's the premium. The last question is, based on my income primarily, am I qualified for a subsidy on that plan that I just picked or not?
And it will tell you based on the income you put in.
That's correct.
We have about 5 minutes. It's time for those phone numbers and how to help and get a navigator. Tell us what that is. Tell us about that a little bit.
Sorry about that cough. I got an email this morning that said the pollen count is up, so that's what I'm
Here it
experiencing.
Hope you're covered.
If one needs help, if they have a health insurance broker, they're helpful. If they go to their local hospital, people will know what they're talking about, and they can usually get help there. Up the road in the Wasatch and Summit County People's Clinic, they have help there. So you can think of a broker, you can think of the hospital at Heber, the hospital at Park City. You can think of the People's Clinic up next to the Park City Hospital on Highway 40. And what they'll run into is helpers. Some are called navigators.
Mm-hmm.
They were actually anticipated under Obamacare, recruited and paid for, and trained and paid for. Navigators will help you get on the website and walk you through it. So will what's called an application assister, and that's a volunteer who's trained and wishes to be helpful. And so for those who need help, good news is there's help out there. Tough news is it's Monday.
Mm-hmm.
And most of these navigators or assisters work on appointments. I called just before I came into the radio program up at the Park City Hospital. They use a navigator out of Utah County. She works 1 day a week, and her appointments are all filled on Friday.
Mm-hmm.
So one would need to work with the two hospitals, the People's Clinic, or there's another group called the Association for Utah Community Health, and they have navigators as well. And Tom, I can give you that number now or after the show.
Go for it.
It's an 801 area code. It's number 716-4600. 801-716-4600. And these are good people who want to help good people sign up for their mandated health insurance coverage.
Now, you mentioned an insurance broker.
Yes.
Is that something you do?
It's something I do for just a few folks.
Okay.
It's sort of a family thing for me, and because I'm an old healthcare CEO, when I moved to Utah, I got my license to allow me to do that. But I've gone on the website just like everybody else. And in fact, I just updated my plans just in the last week.
Is that something that you want to promote? Or is that something you just kind of, will help here and there?
For me, unlike most brokers, so I'm a retired man and,
Right.
And doing consulting. So for me, it's just on a personal contact
Sure.
basis. So I'm not promoting myself as a broker. I just happen to be one. But there are really good brokers out there. There are really good navigators out there. And if I can throw in a little, it's not really a commercial because I don't have any interest in them, but a promotional on these hospitals.
Mm-hmm.
I'm old enough to remember when the hospitals on the Wasatch Back were not at the quality that we have now.
Mm-hmm.
The Heber Valley Medical Center and the Park City hospitals are both Intermountain Healthcare hospitals. They're the only ones on this side. They're excellent. They're primary care specialty hospitals with primary care specialty physicians. And the definition of that is they take care of 80% of what ails you. And here's the part most people don't know. They are the best referrers for subspecialty care. That's part of their training. The worst referrers for care is men.
Mm-hmm.
You wait until you get too ill, and then you end up down in Salt Lake at a specialty hospital.
Yep.
So I encourage, for all purposes, we use these two hospitals, the physicians who reside up here, not just because they're local, that's a good reason, but two, because they're trained as primary care specialists and referral for subspecialty care as needed.
This is KTMP 1340 AM, your hometown radio station, and today's show is brought to you by Guild Mortgage Company. Guild Mortgage Company, NMLS 3274, Equal Housing Lender. Tom Stone, NMLS 257849. The information contained in this training has been prepared and distributed for educational purposes only and do not represent the opinions of Guild Mortgage Company. Do you have a final statement, a final bit of advice? You have about 30 seconds for the listeners out there regarding everything and everything. I mean, this will be fun to see if you can throw this in 30 seconds.
Actually, you asked me some time ago as a friend, what advice would I give to my own family?
Mm-hmm.
And so here's what I would say. I would comply with the ACA law,
Mm-hmm.
quit grimacing about it, and be optimistic. I'd go browsing at the healthcare.gov website. At this point, you better go pretty fast because there's a week left, which is plenty of time. I'd find a broker or a navigator or a consultant to help me if I needed it. I'd consider a higher deductible than usual, and maybe finance that through a health savings account, which I'll give you some information, Tom, you can share with your listeners at other programs. It's a bank account that's much improved over what they used to be, out of which you can pay your deductible expenses each year. I would practice health promotion and wellness. I lost a few pounds. With the clean air up here, I now jog. I'm the slowest jogger on the side of the street, but I do
Oh,
it.
that's you.
That's me.
Do you wear your hat while you jog?
I do. I would select and utilize high-quality physicians and hospitals like I mentioned, these two hospitals up here. And lastly, I would support the county health department, that's public health, the local physicians, the community hospitals, for the reasons I mentioned earlier. They're primary care specialists, best at referral care.
I don't even know how to say thanks enough. This truly is one of those that is across the board information that everybody needs to know about. I thank you for myself, and I'm sure all the listeners out there. Thank you for coming in today.
Thank you, Tom. Happy to do it.
So, yes, people can contact me, and then I can contact you for any questions and what's going on with that and how and what and where and why. See what happens on this Monday coming and if they extend it or not and what happens afterwards and so forth. But thank you for coming today. Again, this is one of the topics of money, and this is one place that you can actually eat better, take care of yourself, and you can save a lot of money. How about that? This actually just went over to the health part of the side. Money is just so encompassing. So thank you again for coming, and we'll see you next week.